Have you had pain on the bottom of your foot or the back of your heel in the past 30 days? If so, you might have plantar fasciitis, which is pain on the bottom of the foot, or Achilles tendonitis, which is pain in the back of the heel. Most people don't realize that those two symptoms are actually created by the same dysfunctions. Hi, my name is Dr. Andrew Grecki. I'm a physical therapist, and I'm here today to teach you how to naturally heal your foot pain and avoid medications, injections, and surgery. And so we're going to talk today about a mobility restriction, and I'm going to teach you how to get better mobility so you can relieve stress on those tissues. One of the most common mobility limitations actually is in the opposite side hip. So let's pretend like I have right foot pain today on the bottom of my arch and the back of my heel, which can happen at the same time. We're going to focus on if I have tightness in the front of my opposite side hip, my left hip, mainly in the front, what that's going to do is when I take a step forward and I land with my right foot, the foot flattens out. And when the foot flattens out, that's normal. That unlocks the bones in the foot. There's 33 joints that unlock in the foot, making the foot a mobile adapter. It's very loosey-goosey. When I then take a left step forward, that motion forward and the motion that occurs in my hips actually is supposed to make the right foot now lift up off the ground, the arch, and that arch lifting up off the ground makes the joints in the foot lock up or get tight. And that's good because that means when I then go to push off of that right foot, my foot is rigid and I push forward off the bones and not the soft tissue. But if I have a limitation in this hip in the front, if it's tight, that's going to make the stride length less and this foot's not going to explode or move forward as much, which is going to diminish what's happening in that right foot, and the chances of that right foot staying flat and loosey-goosey are increased. So real easy description of how to stretch out this left hip. We're going to put our right foot forward, the one that was painful, on an elevated surface. This isn't very high, so the higher the better in this case. So I might use a chair, or I might go up 2 steps. And we've got the left foot way behind us and turned in slightly. Now immediately I start to feel tension in front of this left hip. That's exactly what we want. I'm going to start to move my body forward and back for 30 seconds, increasing the tension here in the front of this left thigh, keeping my back foot turned in. Then I'm going to go side to side for 30 seconds. And then finally, I'm going to go around in circles for 30 seconds. Now, we can do this on both sides, but today the demonstration is designed to teach you that the opposite side hip can actually be causing your foot pain. If you're interested in learning about all the causes and how to treat them naturally, avoiding medications, injections, and surgery, I would highly encourage that you attend our free Achilles tendonitis and plantar fasciitis workshop, which we're hosting right here at Superior Physical Therapy. There's only 20 seats available. There's 2 ways to register. You can call 231-421-9300 and reserve a seat, or you can click the link right below this video and also reserve a seat online. Everybody that attends the workshop gets a 8-video series to self-treat the 8 most common dysfunctions that cause foot pain.